scale. It's a 14-item measure that looks at static and dynamic sitting and standing balance to assess fall risk for patients. To start the test, items that you'll need include a chair with armrests, a chair without armrests, a tape measure on a wall for like a functional reach assessment, an item to pick up off the floor, and a step to complete another measure on the form. So every individual item is scored 0 to 4, and then the total is kept at the end. So to start, you're going to have the patient sitting unsupported, so put your hands in your lap and sit with their back unsupported in a chair for 2 minutes. And you'll see if they can do this safely, independently, or without supervision. And you'll look to see how long they can maintain this position. This is actually item 3, but it's a good way to start because you can do this while you're doing the subjective assessment of the patient. So if 2 minutes goes by, that would be a 4 for the patient, indicating that they can sit safely and securely for 2 minutes independently without supervision. So the next measure would be to have the patient stand up. Try not to use your arms for support. Okay. If they're able to do so without using their hands and stabilize themselves independently, it would be considered a 4. Once they're in the standing position and they're stable, you can see if they can maintain this position for 2 minutes safely. If they can do it independently for 2 minutes, you would be considered a 4. If you think that they need supervision, it would be considered a 3. So 2 minutes goes by. Now I'll have you sit back down. Try not to use your hands for support.
Thank you.
It lowers down slowly. So that would be considered a 4 because it's minimal use of hands and independently. Then you can range the chairs like so. You'll have him transfer from one chair with armrest to a chair without, and then back. So what I'm going to have you do is transfer from this chair to that chair safely. You can use these armrests for support. Okay. Good. And then go ahead and transfer back. Good. And if they're able to do so with minimal use of their hands, it would be considered a 4. Okay, I'm going to have you stand up again. That one you don't have to score. You're going to see if they can stand unsupported with their eyes closed for 10 seconds safely. So go ahead and close your eyes. When you monitor the time, you look for sway. If you think that they would need supervision or definite use or definite assistance, you would rank that a 3. That's good. He was safe, I would call that a 4. Now I want you to bring your feet closer together. You're going to bring them side by side. Bring them a little bit closer so that they're touching. Good, and you want them to stand here without holding on to anything and see if they can hold this position safely for 1 minute. So you would time this. And the difference here between independent and requiring supervision is seeing if they have a lot of sway, if they're using ankle strategies versus hip strategies versus stepping. So if he's able to do this for 1 minute safely using ankle strategies and maintaining his balance, then I would call that a 4. Okay, now I'm going to switch sides. We're going to do the functional reach assessment, so you can have the patient step over here to the tape measure. Feet on the same line, shoulder width apart. And I'm going to have you reach your left arm up straight with your fist closed in front of you. Okay, use the third knuckle as reference. See their starting point. Go ahead and reach forward by bending at the waist as far as you can. You get the third knuckle at the end. Go ahead and stand up. So that was about 14 inches. On the Berg balance scale, if they can reach forward 10 inches safely and confidently and without supervision, then you would consider that a 4. If it's 5 inches, it would be a 3, and if it's 2 inches, it would be a 2. Okay, now do you need a rest?
No.
Okay. Then you're going to have the patient pick up an item from the floor. The Berg balance scale recommends a shoe or a slipper, but any sort of object that they can grab easily would be good. So you can put this on the floor. Can you bend down and pick that up for me, please? Good. If the patient can pick it up safely and easily, it would be a 4. If you think that they would need supervision to do so safely, it would be a 3. Okay, thank you. Also in standing, you're going to look at their ability to weight shift. So what I want you to do is standing here, you're going to look behind your left shoulder, and then you're going to turn and look behind your right shoulder. Okay? Good. So what you're looking for is their ability, good, and go ahead and look over your right shoulder. You're looking at their ability to shift weight to the opposite side and turn fully and look over their shoulder. Good. Stop there. So if they're able to do so safely and symmetrically and shift their weight, then you would give that a 4. Okay, now what I'm going to have you do is you're going to turn completely in one circle until you're facing this way again, and then you're going to turn in the opposite direction until you're facing this way again. So one full turn one way and then the opposite. Okay? So in this, you're going to time them to make sure they can do a complete circle in 4 seconds or less. Okay, ready? Go. And the opposite. So he was able to complete one circle in less than 4 seconds, so that would be a 4. Okay? Now we're going to do a tandem stance. You're going to assume the tightrope position, put one foot in front of the other. So with this measure, you're looking at their ability to bring themselves into that position. So he was able to stand that way independently and hold that position. And we're going to look at his ability to hold that for 30 seconds. So he looks good there. So that would be a 4. Go ahead and stand normally. Okay. Now I'm going to look at your ability to stand on one leg. So go ahead and stand on your right leg. I want to see if you can hold it for 10 seconds. Good. And then the opposite side. So with the Berg, they only look at one leg, but they want to make sure that the patient can stand and assume that position in single leg stance independently and hold it for 10 seconds. So this would be a 4. Good job. Okay, the last measure, which is actually number 12, go ahead and have a seat, is going to require you to use a small step. So we have a curved step here. Okay, so what I'm going to do is I'm going to have you stand, and then we're going to have you place alternate feet on the steps, just like this, until you count to 8. So it'll be 4 with each leg. And I'm going to time you and see if you can do it in 20 seconds. Okay, so go ahead and stand. You can get a little bit closer so you don't have to reach to it so far. Okay, so when you say go, that's when the timer starts. So go ahead and go. 5, 6, 7, 8. Good. So that would be done in less than 20 seconds, and it was alternating. I didn't feel like I needed to give him assistance. He was able to do so independently, so that would be a 4. Okay, good job.
All right.